Welcome, esteemed doctors, to another session of USMLE Success Stories. I'm Dr. Gregory Ben, and today I have a special guest, one of our esteemed chief residents at Howard, and now a fellow moving into our attending position. Can you please introduce yourself, Dr. Mary?
Thank you, Dr. Ben, for having me on. It's a pleasure joining you guys today and glad to share my experience as well. My name is Dr. Fakorede said. I am a foreign medical graduate and I'm a family medicine physician and recently completed fellowship and taking a well-deserved break right now to go into my attending position. So that's just a snippet about me.
Yes. Thank you. So let's get to the secret sauce of what got you to this position currently. If you can tell us a little bit about your journey and your overall journey in medicine. Go ahead.
Yeah, like during the introduction, I'm a foreign medical graduate, specifically did my medical school in Nigeria. And right out of medical school, I relocated to the United States for family reasons. And so the journey began. I thought it was going to be an easy one, just pass your USMLE and yep, boom, you get a position. But turns out that, it took a lot more than that. So I came in, did my steps, and I did my step two, I believe, and people said, just get some experience, and you'll be able to get a spot. But I realized that then you needed step three, even before residency as a foreign medical graduate. So I took on that challenge, did my step three, and once I finished that, I focused on getting clinical experience in the US, which was kind of hard to get during, while I was trying to get a residency spot. But thankfully, the most valuable experience I was able to get was an externship. It was a clinical externship, which was unpaid. And looking back, I'm really glad I was able to get that experience. I did that for about a year. And I believe that kind of opened the doors for me because I was ready to take on the role of a resident from day one. So I did that for a year, and then thankfully I was able to get into family medicine at Howard University Hospital, where I met Dr. Ben, and did 3 years of of residency there, where I also became the chief resident of of research and quality improvement. During my third year of residency, I realized that I was interested in addiction medicine, so I did apply for addiction medicine fellowship, and I got a position at Johns Hopkins in Baltimore, and I did a year of addiction medicine fellowship there as well, which I recently completed. And once I'm done with that, then I'll be heading over to the VA as a primary care physician in DC. So that's a little bit of my journey. And what I would like to say, emphasize on is that as a foreign medical graduate, you just have to find, something that, differentiates you from the rest. And for me, the clinical externship really, really did work in my favor. And that's one thing I'll strongly emphasize if you're looking for, a spot in the US here. Try to get on a clinical externship program, especially if it's not paid. That speaks a lot of volume during your interviews. It helps you during your interview process as well because you now know the terminologies that residents use from day to day. So that's really a valuable one for me. And
Well, thank you. You were very detailed in your tips and your journey. I appreciate that.
mhm.
Now, when we look at what you said, I think you mentioned a couple important things. As you said, step three, that tends to be super important if you're a foreign grad coming in. It's always a good idea to try to hit step three. Now,
Mhm.
apart from step three, I agree. If you can get the externships, I wasn't able to do that, but it adds to your application. It makes your journey better. So thank you for sharing that. Those are some very important points. Now,
Mhm.
I'm gonna just try to take you back to before you actually matched. Now, and you were a chief. So let's just picture for a moment you are applying to the match. and you're in the hot seat of residency interviews. Can you recall any specific questions or any questions that you might have asked that you were asked during your residency interview journey?
Yeah, I remember my first one. I would say I wasn't prepared, for and maybe a little bit of anxiety as well, being your first ever interview. But that kind of gave me. I'm happy I went in for that one and learned my lesson, and I went back to the drawing board. I remember my friend would tell me then, she was a little bit more aggressive than I would be. She said, "You only got this one opportunity." She would tell me these are the questions to practice. Put yourself on camera, answer to those questions, time yourself again and again and again, and practice. I mean, for some people it comes naturally, but for us foreign medical graduates, sometimes it just doesn't come naturally. So the common questions you're going to come across: why are you interested in this program? Tell us about yourself. Those are like, you have to be able to nail those questions. Yes. So those are, and even as you go on across your journey, even after residency, these are questions that you would always be asked. So it's always good to kind of be prepared. Tell us about yourself. Tell us, why are you interested in this program? Why are you interested in this specialty? Why should we choose you? We have thousands and thousands of applicants. What are you bringing to the table? So I think, if you have those, questions, you can just walk into an interview without knowing those questions very well. So those are some
Yeah,
of the questions you should be prepared for.
absolutely. Absolutely. I think those are the essentials. Now, your remarkable success in medicine deserves admiration. As I said before, you've been an exceptional resident. I know you during residency, you were always one of the top notch, one of the persons that we can always throw something out to, and you'll get it solved. Now, what do you think are some key factors that contributed to your achievement?
Thank you, Dr. Ben. Yeah, so I think when you enter into residency is a is tough. If anybody tells you otherwise, then they're not telling you the absolute truth. But it's doable. People have done it times past, have succeeded. So if you go in with that mentality and you give your best, remember you're not just doing it for just passing through residency. You're doing it for yourself, doing it for your patients, you're doing it for the overall good of your patients. So if you could go in with that mentality, and you're going to be successful. Truly, it does get better. So questions, make sure you're asking questions. There's no stupid questions. It's better you ask than keep silent. But again, hard work, make sure you ask questions and be that intern that comes in early and leaves late. And again, when you're doing that, know that you're really doing it for yourself. I tell you, residency is also full of politics, but you have to be able to separate the politics and focus on the goal. And at the same time, there wouldn't be time for you to dedicate a study time. Learn as you go. Every patient experience is a teaching, is a learning opportunity. You come across a case, check, instantly as you go. There won't be a dedicated time for you to study. So, but go in, give your very best, be that reliable resident that your colleagues can also rely upon. Because oftentimes you'll be called to fill in for your colleagues. Be open to that. Be that reliable resident that people can always fall back on. And those are a little bit of the tips for success in residency for me.
Thank you. I'm gonna put you on the spot once again, probably for the last time. Now, what is one of the most important things that you think a residency program is looking for in an applicant? Maybe one or two.
I would say that honesty. They can read through you when you're interviewing. Honestly, don't sound scripted. If there's any answer you genuinely don't know, don't try to make it up. Just let them know that you can probably get back to them with a better answer. Honestly, I remember I was asked a question during my interview. I'm not sure what exactly it was, but I knew my program director, felt like I answered honestly just based on his facial expression. I said, if there's anything challenging that, comes my way, I won't be afraid to ask questions. And, that was something that came from my heart. So just be honest. You don't have to have answers to all the questions in an interview, even though I advise that you're prepared. But if honestly you don't know, just say you promise you'll get back with that answer for them. So I think, being honest, I think goes a long way because you need it. As physicians, we're supposed to be honest anyways, but for foreign medical graduates, you can be tensed up, but just, try to relax as much as possible and, be honest with your answers.
Yeah, I agree. I think honesty is the best policy, and that's something
Mhm.
to remember. That's
Yeah.
also my number one tip to
Yep.
resident or to any aspiring to match. Honesty is the best policy.
Yep.
Now we're gonna wrap things up. Are there any key takeaways that you would like to leave with our audience?
Yes. As we wrap things up, as foreign medical graduates, you're one amongst thousands, and now you even have interviews on, it's virtual now, so that opens up the slot for so many people. So I would encourage you, don't let that deter you. Keep your focus on the journey. There is a slot for you if you're ready and willing to work hard for it. Keep fighting. Keep your eyes on the goal, and definitely, you will get that spot that you desire. Keep the hard work. I tell people, whatever thing you're doing right now, every experience that I gained along the way, they turned out to be valuable during my residency, be working as a in a non-clinical spot. So every experience that you have opportunity to lay your hands on, even if it's not externship, do it well. Because you will need these people along the way. You be letter of recommendation, and if you work with someone and you require a letter of recommendation from them, they're going to comment on your work ethic. So be that outstanding physician every step of the way, and I wish you good luck on this journey. Yeah.
Well, thank you. We extend our sincere gratitude for you coming and taking the time out of your busy schedule to share your experience and expertise with us. I guarantee you that it will inspire countless residents and future residents. And thank you again. Have a good one.
thank, thank you, Dr. Ben, for having me. That's just a snippet.